to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today we're talking about a question many patients quietly ask themselves. Should I be looking farther away for care? Most healthcare journeys begin close to home, naturally. Local providers are familiar and convenient, but sometimes, despite doing everything right, progress stalls, and patients start wondering if expanding their search might be the next step. Seeking out of state or out of country medical care can feel overwhelming, but in certain situations, it may be exactly what's needed. So let's break down when and how to consider that decision. So joining me today is Christine, a member of our team. Hi, Christine. How's it going?
I'm doing great. Thank you so much, Dr. Borelli, for having me here. And yeah, so can you share what are the signs that it might be the time to look beyond your local care team? Like how do you know when your local care team isn't moving forward?
So one of the clearest signs, in my opinion, is when your care feels stuck. You may have seen multiple providers, completed extensive testing, and followed treatment plans, yet still feel like you're not moving forward. That doesn't necessarily mean that something is wrong with your local team. But some conditions require highly specialized programs, multidisciplinary teams, or advanced treatment options that simply aren't available everywhere. And also, too, a lot of these things are very time sensitive. So you got to kind of make that move, and the sooner the better. When progress stalls, expanding your search can open the door to new expertise and fresh perspectives.
I got you. Let's talk about specialization. When is it important enough to justify traveling or decide traveling for medical treatment or care?
So, certain hospitals and specialty centers are known worldwide for specific diseases or advanced procedures. For rare conditions, complex cancers, or highly specialized surgeries, expertise can vary significantly between institutions. Some patients seek care in another state within the US. Others explore programs in Canada or parts of Europe where treatment philosophies or specialized programs may differ. The goal isn't simply to travel farther, it's to find the right expertise for your unique situation. That's where guidance becomes essential.
Yeah, and sometimes it's not about a new treatment, right? It's about a new perspective. And how powerful can a second or third opinion can be?
It can be transformative, honestly. A fresh set of eyes may identify overlooked details, suggest new treatment pathways, or even clarify a diagnosis. Second opinions are not about disloyalty to your current providers, they're about ensuring every possibility has been thoughtfully considered. Preparation is key here. Organizing medical records, summarizing your history, and preparing focused questions can make these consultations far more productive.
Right. And traveling for medical care isn't just a small decision, right? It's a huge decision. So what should patients think about, before traveling for care?
So there's several important considerations. Provider credentials and facility reputation, communication and language support, insurance coverage and financial impact, travel logistics and recovery needs, how follow up care will be handled once you return home. Medical travel involves more than just scheduling an appointment. It requires planning to ensure continuity and safety. Thinking through these factors ahead of time reduces stress and unexpected complications. One thing that we do a lot is we actually speak to the care team, the doctors, the providers, if they're out of the country or out of the state, to kind of make sure that kind of everything's aligned and on board as much as possible prior to going there so that you have optimizing your time there. There's an understanding of what's needed before. So there's to try to prevent all of these hiccups or delays when you're actually there and things like that. And so we really work very individualized to make sure that things are as smooth as possible.
Right. And this feels like a moment where a private patient advocate can really make a difference. So how can pathway patient advocates help in this process and in this type of situation?
Absolutely. Pathway Patient Advocates helps patients evaluate whether medical travel is truly necessary or if other options closer to home may exist. If travel is appropriate, then we exist with identifying reputable programs, coordinating and organizing the medical records, preparing for consultations, helping patients understand the differences between uh, treatment approaches, and then managing the logistics and follow up planning. So, our goal is to make decisions informed and not overwhelming.
Right. For someone sitting at home wondering if it's time to look farther, what would you say to them?
If you're consistently feeling stuck, unheard, or unsure about your next steps, it may be time to explore additional options. So, seeking care elsewhere isn't a sign of failure, it's a proactive step toward clarity. And you don't have to make that decision alone. With the right preparation and guidance, expanding your search can feel empowering rather than intimidating. And at Pathway Patient Advocates, we work alongside patients and families to evaluate options, coordinate medical information, and guide decision making every step of the way. If you're wondering whether it's time to look further for answers, reach out to us because we can help. Because sometimes the right care may be closer than you think, even if it's farther away.
I love that, and that's absolutely true. Dr. Brelly, this is such a great episode, and I know a lot of people would really love this. And for anyone looking for help for themselves or for their loved ones, there are so many ways to reach out to us. You can give us a call at 947-517-8395.
Thank you, Christine. It's been a pleasure as always. I know I always say that, but it's true. I hope this conversation helps our listeners feel more confident as they navigate their healthcare journeys. Have a great day. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.